have to some extent, or the kidney, the tumor will not start melting away because the body knows that if it starts melting it away, it can kill the person because you have chemicals there as well as the tumor byproducts, which is like rotted meat. It really is that. It's like pus going in your bloodstream. So you need to first make sure you're cleaning that way. And the second thing is, what are you putting on your body, like Miguel was saying, that could be causing more chemical overload, such as toothpaste, deodorant, and the
Cleaning products?
cleaning
also?
products such as soap and shampoo.
Okay.
Those are the main things. And we have together devised products that are chemical-free, non-toxic. Very important. Toothpaste, deodorant, body powder, as well as suntan lotion, protector, and shampoo and soap to start out with. And then you clean the house. You go to that next level, cleaning the house. No extermination. Instead, use aromatherapy as a natural extermination. Use natural cleaning products based on essential oil-based products. That's the next step. And this is how we slowly go and clean that environment and detoxify that person.
Then we're going to have a very healthy house.
It's becoming the time to have one because it's affecting human health. One of the most abused product and misunderstood products is actually talc. You find talc in baby powders, you find talc in cosmetics and so forth, and talc is in the list of those that cause cancer. Talc is as closest to asbestos as any chemical. So it's very, very simple to replace talc by just going into your grocery store and making your own powder with cornstarch and a little baking soda, which is a natural deodorizer. And you have your very healthy powder that you're able to inhale with no health effect. So that's one thing to watch out for, of many. There's no need to go crazy about the whole thing. Obviously, if you have a history of cancer or immune system, or if the elderly and the young should be very aware of this. It's just a time to watch in what you use.
So, Dr. Marcial-Vega, how do you do your treatments? With chelation to clean the body?
First of all, chelation, first we have to realize that chelation also takes away some minerals that are essential for the body.
Okay.
So I first detoxify the patient, revitalize them, give them a lot of nutrition for a month or two before I do chelation, because chelation for someone that has a cancer or is weak can be too much too quickly. First of all, I would recommend patients, if they want information on cancer, is to buy this book. The Definitive Guide to Cancer was just published 2 months ago by the Future Medicine Publishing Company. And there's 23 physicians that have, each one has a chapter explaining how they treat cancer with natural methods. I have a chapter in this book, so patients that are interested in getting more information are encouraged to get a copy. What I do is, once I know that the patient is cleaning their system, plenty of water, as well as essential oils used by rubbing in the hands and smelling 6 to 7 times a day, as well as using baths daily for 20 minutes, where they can put 10 drops of the desired oil.
Mm-hmm.
Some oils that are anti-cancer are lavender and orange. They can be put in the bath, but not any lavender and orange. Only the quality of the oils that you can see here, that Miguel Cisneros has and that I use, are the ones I would recommend for this type of use. In addition, detoxification with coffee enemas is an important thing, as well as a colonic, to see how the intestine is. If the patient does not have a healthy colon, they're not gonna have the first step to have this thing work, which is elimination. That's a crucial step in order to have something work against the cancer.
Well, thank you very much. Miguel, what you can tell us about all this? Is little bottles here, essential oils. That,
Well, there are different extracts of flowers and plants. It takes about 400 to 700 pounds of the herb to make just a few drops of the essential oil, so they're very powerful. And the oils that Dr. Marcial-Vega uses, that's an example of ylang ylang, first grade extra, which he uses it for patients with high blood pressure. And upon smelling it, it seems like It has an effect on the blood pressure. It brings it down. He mentioned that not all the essential oils that you're confronted with are the right kind, and that just needs a little explanation. Essential oils are just like if you have a tea bag, 1 tea bag and 10 cups of hot water, and you're going to make tea. The first 2 tea cups that you make are the strongest.
Yeah.
The last one is the weakest. All of them are 100% tea. But in essential oils, the first batch and the second batch are your therapeutic. The other ones are different grades, which is what you find in the shelf. Of course, you cannot have the really Lang first grade extra in the shelf because someone with low blood pressure will smell it and they could faint.
Thank you.
So there is a difference in the essential oils and the quality. And also, the first grade and second grade are less to cause an allergic reaction in asthmatic or anyone with allergies.
Dr. Marcial-Vega, how do you know the dosage that you have to give to your patients?
I slowly increase the amounts that I give the patient. And I don't give 20 or 30 things, because otherwise that can confuse what is causing what, and it's confusing to me and to the patient. I start with 3 basic things. One of them is giving essential oils. The second one, giving the water-soluble component of the herb, which is like a tea, herb tea.
Yeah.
And the third one is a food supplement that is a clay, it's a natural clay that gives all the minerals that the organism needs. And I use different routes of giving these medicines: by mouth, eye drops, intrarectally, pulmonary through the lung, and the skin. Because the body will absorb in different ways, in different places, and at different times. So I use all the ways to get the things I need to get into that person as efficiently as possible. All these components that will then revitalize the body. I use, for example, I use herbal teas. This is an example of one of the ones I use that is called blood cleanse, and it's taken by mouth. This will be taken and it will give the blood all the natural ingredients the blood needs in order to function properly. And it would also clean the system by taking away pus from areas that have toxicity. For instance, I would use this in an eye preparation that is over here, that is given, this put 1 drop each night in each eye, and the next day a lot of the patients will see pus in the eyes. That means that this is pulling out, not only giving the person nutrition, but taking out pus and junk that it doesn't need. And it cleans the eyes, and it helps with many conditions of the eye, which is the same as this tea over here. Then I have another preparation, which is this one here, that is given in the lung. It goes directly into the lung for lung situations, tumors, infections, and it goes directly into the bloodstream through the lung. And that can also clean from that angle. And this is given through a mask, a nebulizer mask, that I have right here. The liquid of this herbal preparation goes in this receptacle. Then a machine will start producing a mist of air that will make a mist of the medicine, and this can be breathed into the system. It'll take care of nasal problems, congestion, sinusitis, asthma, and infections. I don't recommend antibiotics for any infection of the lung or cold. I recommend natural things because I have seen how quickly they work. And the next thing I use is giving, for example, the clay with essential oils, aromatherapy, rectally, with a preparation like this. This goes in the rectum, then this is pressed and puts the natural medicine, clay and aromatherapy, in the rectum overnight. And this is absorbed by the rectal blood vessels into the system directly, and it can kill herpes virus in the blood, HIV virus, it can kill tuberculosis in the lung. So sometimes essential oils, it takes a while to take them by mouth because the mouth is sensitive. So I use a lot the rectal route, very effective.